Morning, everyone. You good to go?
1 second. Everyone good? Senegal.
So today we can announce that there's 2 new cases in Queensland. This will bring us to 11 active cases. Of these 2 new cases, one is a crew member of a super yacht in Cairns. And they have now been put into quarantine. The rest of the crew are in quarantine, or the majority of them that are not on the boat, and the positive case will be in hospital. We will be testing the other crew to check whether they are negative or positive. The other case we have is a southeast Queensland resident who travelled to the northern beaches in Greater Sydney and has came back. Initially got tested on the 18th with a negative test, but has since tested positive after becoming unwell. That person, I want to say thank you to. That gentleman has done everything right since coming back into Queensland. He has been isolating himself in quarantine at home, which has significantly reduced any risk of spreading this to other people. And this is the gold standard of what we expect of anyone who has travelled from the northern beaches and has been told to go into quarantine in Queensland. So we thank that person for that, and I remind everyone who has travelled to the Greater Sydney areas or the northern beaches that you should be getting tested and you should be quarantining as per the directions. I want to thank also all of the people who have gone out and got tested in the last 48 hours. We've had almost 25,000 tests in 48 hours. We know that it's hot in Queensland and it's uncomfortable to line up for testing, but I want to say thank you, because by doing that, you are helping keep Queensland safe. We have made sure that our hospital and health services are dealing with those surges, and we did see a reduction in waiting times for those tests yesterday. But our message is clear. Our clinics will be open over Christmas. There may be different clinics or different hours, so please go on to the Queensland COVID website if you need to go and get tested. But importantly, testing will continue over Christmas. If you wake up Christmas Day with any symptoms that are in line with COVID, we still want you to get tested, because the vaccine's not going to take a holiday on Christmas Day. We need you still to get tested and to isolate yourself until you get those results. And of course, if you're from those hotspots and you've been directed to quarantine for 14 days, we still require you to do that. So New South Wales, it's been 10 days. 10 days since they first reported positive locally acquired cases on the northern beaches. We know New South Wales now has over 100 locally acquired cases from that cluster. Queensland's also got a milestone. Today, we can report 100 days since we had a locally acquired case. 100 days. And that's because of the amazing work of all Queenslanders. We want to say thank you on this Christmas Eve for all the great work that people have been doing, our businesses, the tourism sector, our pubs, clubs, hotels, right across Queensland. It is the great work of Queenslanders working together, united, that has meant we have gone 100 days since a locally acquired case. But we cannot afford to get complacent, because with the positive surge that we have and the fact that we have this positive case from the northern beaches, we believe that we have positive cases in Queensland. We hope every one of those positive cases are in quarantine and isolating as directed. We have now 53 close contacts from New South Wales. New South Wales are still tracing contacts since the 11th of December. So as recent as the last 24 hours, people were being contacted in Queensland and told that they have been in close contact with a positive case right back since the 11th of December. So that means we're getting very close to that 14 days, being tomorrow, that people are only just finding out now they have actually been in contact with someone who's positive and are being asked to isolate. So anyone who has been to those hotspots, again, Queensland is relying on you to quarantine. Queensland is relying on you to get tested and to make sure if you have any symptoms, you go back and you get tested again if you've already had a negative test. Because as we saw with this gentleman, his first test was negative, but he has now showed up positive at a later test. So you could have it, and that is why it is absolutely imperative that you maintain that 14 days quarantine. We are concerned about the super yacht case. What this message says is that no one is immune from this. The super yacht in question has not been very cooperative at all in relation to the information being provided to the Queensland Police Service and where they have been, so we can identify whether there is any other cases or where they may have got it from. So we will leave that for the police to deal with, but we are very disappointed that this super yacht is not cooperating and providing factual, correct information to the Queensland Police Service. So our message on this Christmas Eve is that we encourage you to get tested and stay at home if you're unwell. That if you are from a hotspot and you are in Queensland, you must continue to quarantine as directed. And we want to make sure everyone knows that there is testing available over the Christmas period. Because as much as we all want this to be over, when we wake up on the 1st of January, we will still be living with COVID. We need people to be vigilant. For our businesses who are doing it tough, for the tourism sector, again, if you are a Queenslander looking at holidaying, have a look and see if there's vacancies around Queensland. Help support our tourism sector in Queensland and go holiday there. But the most damaging thing for the tourism sector in Queensland is if we have a cluster. If we have a cluster breakout in Queensland, then that will mean significant restrictions, and that will be very damaging to the sector. So I know that the tourism sector is doing it hard right now, but it will be far worse if this case gets out into our community, and that's why we have to do what we are doing, and we'll continue to work with the tourism sector to support them and to make sure that we are encouraging people to holiday in Queensland. And of course, anywhere else in the country outside of the hotspots, you are absolutely welcome to come to Queensland. We are good to go, and we want to see you holidaying here and enjoying the Christmas break. The last thing I'd say before I hand over to Dr. Young is that we know at Christmas time everyone wants to hug. We want to be close to each other. Please, let's follow the social distancing rules. Let's make sure that we are not handshaking, that we are washing our hands and sanitising regularly. We are following all the rules that have been there since the beginning. We ask this of venues, but we ask this of citizens who are visiting Queensland and who are Queensland residents. Please help us stay safe. Let's make sure that we don't have anyone in ICUs over Christmas. We want to keep people out of our hospitals, and we want to keep people out of ICU beds because we want to keep people safe in Queensland. Dr. Young.
So 2 new cases in Queensland overnight. The first is a woman in her 20s who arrived into Cairns on a super yacht. So all of the people who arrived into Cairns on that super yacht went into hotel quarantine except for 6 crew who remained on the yacht to maintain it, to keep it safe. We're now testing those 6 crew and ensuring that none of them have COVID-19. So the super yacht originated in the Maldives and then came to Cairns. So we're trying to work through with them how it got on to that yacht. But it is a lesson to us all that super yachts that have come from elsewhere in the world, no matter how long they might have been at sea, are a risk and are required to quarantine all of the people on that yacht, either in hotel quarantine or for those few remaining crew that must stay on the yacht as per Maritime Safety Queensland's requirements. They can stay on the yacht, but we still manage them to ensure that the virus doesn't get through that route into Queensland. Then our second case is a gentleman in his 40s who went to the Northern Beaches on the 12th of December, then stayed in Sydney after that, arriving back into Queensland on the 18th of December. He went into home quarantine after initially testing negative when he first came back, went into home quarantine and has been there since, and I commend him for what he has done. He has followed every single requirement to the letter. He became unwell, so he went and got tested again and came back late last night as a positive case, so he's now being transferred to the PA hospital and we'll manage that. We don't believe, but we're talking to him again, of course, we don't believe he's been in contact with anyone in the community other than close household contacts who are now in quarantine for 14 days. So he's done everything that was asked of him. We're just confirming that now to make sure that there isn't anyone else out there who also needs to go into quarantine. Now, he was not one of the 53 people that New South Wales Health has let us know about who are close contacts of known cases. He was someone else. So that's why it is so important. Don't wait for a text message from New South Wales Health that you're a close contact of someone from the Northern Beaches or from elsewhere in Sydney. If you have been in the Northern Beaches, you have been asked to go into home quarantine up until just recently when everyone goes into hotel quarantine. You must absolutely stay in home quarantine and shouldn't have contact with anyone else and absolutely shouldn't have visitors to your house. That is very important because I am concerned that we do have the virus now in Queensland. We have seen those positive sewage results and we know that there are a lot of people who have come back into Queensland from that Northern Beach area and from other parts of Sydney. So it is really important that everyone goes back to maintaining that social distancing, and anyone with any symptoms, please immediately come forward and get tested. We will have clinics open all through Christmas and New Year. They might be slightly different, so please go on the website and just check which is your local clinic and the hours it's operational. But if you have any symptoms, please come forward, as those over 20,000 Queenslanders have in the last 2 days, come forward and get tested. That's what we can do to protect everyone. Now, if I could just briefly mention, there's been some confusion about the new requirement that hospitality venues must have electronic recording. That is on the venue. The venue must have a way to electronically record everyone who comes into that venue and to store that information for a minimum of 30 days, a maximum of 56 days. That's critical. But we at this stage have not required the use of specific QR codes. I know that has happened in New South Wales. We have not done that in Queensland. So if you don't have a smartphone, you can still go to your favourite venue. It's just that that venue will have to capture your details in an electronic format in their database, so they have that information. It will be kept private, and its only use is to give it to a contact tracing officer if it's needed. Thank you. Happy to take questions.
What was the advice for Christmas Day in terms of hugging? The Minister mentioned social distancing. Are you allowed to hug mum and dad or grandpa and grandma?
I would restrict that to your close known contacts, so your close relatives, the people who live in your household. I would not be doing that in broader groups outside. I just think that's a risk that's not necessary. Now, if you're having Christmas Day with your close family, then you're having a lot of time with them, so you would be deemed a close contact. So yes, you can, if that's your normal tradition, hug your close family members. But I just say to people, think carefully. So maybe it's not the time to hug, your great-grandmother. It's a time to think how best you can keep your older relatives, your most vulnerable relatives, safe.
With the super yacht case, do you know how recently it was overseas or how long it had been in Australian waters or any of that kind of information?
I do have it, but I don't know it off the top of my head. So it's fairly recent that it came into Cairns because all of the people were still in that 14-day quarantine period.
Are we still on track for January 8 border reopening?
We'll just have to check, because you might remember that New South Wales has had that unlinked case, someone who lives in Western Sydney, who's a driver for the New South Wales Health Department, who moves people, international travellers, from the airport to their health hotel. So that person became positive. Initially it was thought from one of the cases that he'd actually driven from the airport to the health hotel, but now genomic sequencing has shown that he's actually got the Avalon cluster genome, but they don't know how he's acquired that. So he's an unlinked case at this stage. So that was announced on the 22nd of December. If that remains unlinked, then it would be 28 days from that date before we could open.
On cricket,
Yes.
you're going to be granting an exemption. What are, I guess, the processes there with that?
Right, so I know that those cricket matches that have been played in other states, those cricket players have been part of a bubble, and we've had that experience before. If you will remember, that's the process we used for the NRL and the AFL and for other sporting codes. So these cricketers have been part of a bubble. They will go into Sydney and continue to be part of a bubble. Then, if the decision is for the match to go ahead in the current arrangements, and that has not yet been decided, it's been worked through, they would remain in a bubble and they would come into quarantine in Queensland and continue to be part of a bubble. But I stress that those discussions are happening now and things could very well change. Nothing's been determined at this stage.
But you've given an exemption, it sounds like AFL and NRL players.
If all of those things are in place at the moment, if they've been in a bubble in New South Wales and not come into contact with the general community in Sydney, and if they remain in that bubble coming into Brisbane, then I think it could be done, but there's a lot of work to be done before that decision is made.
What's been done with the testing? Because there was a lot of complaints 2 days ago that queues were 8 hours. There's one person taking swabs at one place on the Gold Coast. Yesterday there were claims that people were put off because of those queues when they saw that. Do you think that was the case, and what have you done to sort of increase resources? So
they immediately put in place more resources, rapidly led to an improvement in those waiting times. So those waiting times are much, much lower now, and I would encourage anyone with any symptoms, or if they've been in New South Wales, in Greater Sydney, to come forward and get tested today.
What is the rough waiting time? Do you have a time there?
It varies. You can go online, you can find out, but it varies throughout the state. I would suggest if you go to one place and there are very large queues, go online and see where there are other sites.
How worried are you about the UK strain, the new one?
Yes, so initially we were told about a new variant in the UK that was potentially up to 40 to 70% more infectious, and that was taking over the strains that were circulating in the southern part of England. So we were aware of that. We've gone back and checked all of our people who've arrived from the UK over the last month. They've all had their genome of the virus sequenced, and none of them have that particular strain, which is good. We know there have been 4 strains interstate, 4 people interstate with that variant, 2 in Melbourne and 2 in Sydney. They've been in hotel quarantine, so I'm not concerned. They should have been managed there. And the strain that's circulating due to the Northern Beaches cluster is not that strain, so that's all reassuring. Now, overnight we've heard of another strain with further mutations, another variant with further mutations that looks like it might have started in South Africa, or at least they've picked it up there, and it's also been picked up then in the UK. And the early information, but it is very, very, very early, the early information is that it might be even more infectious. I think that means for us here in Queensland that we have to be even more cautious than we've been to date with anyone who comes from overseas into hotel quarantine. So I've spoken to all of my colleagues around the state this morning and said that we have to be exceptionally cautious about anyone from overseas who is in hotel quarantine, that we cannot have those fresh air breaks, which have now stopped, that we cannot have people leaving hotel quarantine for any reason unless it's a threat to their life. Of course, we have to provide healthcare services to them if they need them urgently. If they don't need them urgently, they should be using telehealth to provide that service. And, of course, if anyone becomes positive in hotel quarantine, we immediately move them to a hospital. So we have upped our response. Not that I'm concerned by our hotel quarantine in Queensland. It has proven to be very, very effective for us in Queensland till now, but I have increased some of the security and the arrangements around it.
Just on Miss Queensland, who's come from the Northern Beaches, so obviously since he was home quarantine, is there concerns that the people who were in his home were going out into the community still, or were they isolating?
He was isolating separate to the other people in his home. So he was genuinely doing that. I'm very confident about that. But despite that, we are still asking the other people who live in that home to go into 14 days quarantine, recognising the enormous impost on them and also to everyone in Queensland who's been asked to go into quarantine at this very special time of year. It's unfortunate, but we must all do it, and those other people who live in that home I think are low risk, but they need to go into home quarantine for the next 14 days.
If he arrived on the 18th of December, was it a requirement at that stage to isolate in your home for 14 days?
Yes, because he came from the Northern Beaches. Yeah. So he's followed all of the requirements that he's been asked to do, and he's managed them exceptionally well.
And on the other case in North Queensland, is that positive case an Australian citizen?
I don't have that detail, sorry.
Health Minister,
Sorry.
just to clarify, with the venues who are required to obviously have the electronic check-ins now, if they don't, under the health directives, can they actually be fined?
So if they don't follow the health directive, a venue can be fined. But the health directive is about saying we want to make sure if a contact tracer or public health unit official walks into your venue and says, I need to trace everyone who has been at this venue on this date at this time, that they can provide us that list electronically in a very short period of time. So that's our main aim. How they choose to collect that, we're being flexible in understanding that there'll be venues from time to time that don't have internet access or other accessibility issues. And there will be some patrons who don't have a phone, they're not travelling with anyone with a phone, and the venue itself doesn't have internet access, that there may need to be other measures in place. What we're trying to move away from, though, is there's venues who have paper registers just sitting on the front counter, and I saw it again last night, sitting on the front counter as an option to either do the paper register or a QR code. It really is the obligation of the business to stop that group coming in and checking that is anyone in that group got a phone. Now, I saw a couple of people yesterday. One didn't have a phone that could scan, but the person they were with did. And I pointed out to them that their friend could actually check both of them in. So it doesn't have to be the case that every single person in your group has a phone. As long as one person in your group has a phone that can scan a QR code, then you can scan everyone in. So we just need everyone to do their part because we need electronic records. And New South Wales has found this, that there was significant delays in accessing this data. The difference between being able to contact everyone within an hour of being known that they're a close contact to a positive case, as opposed to days, because the venue says, well, we've got all this paper-based, or they can't provide the electronic quickly. Every day counts when you are a close contact to someone who is tested positive. Every single day. And what we are seeing from New South Wales is there are still people being traced today who have been in contact with someone from the 11th of December. That is a significant period of time. We are getting to the end of the 14-day period, and some people who are close contacts still don't know they're close contacts. So that's why we are asking all businesses to do this, and we want to work with businesses. We're not out there with a big stick wanting to fine every business, but we do need to change our behaviour out there and do everything possible to store this information electronically. So if we have a positive case, we can get those details the same day, and we can let people know what's happening.
Has the government signalled any interest in taking the Sydney test if they can't hold it there? Would we have 2 at the Gabba? We've got every other sporting event.
Well, if we can agree on how this bubble works, and this bubble will be very stringent, it is really important. And can I be clear, when we talk about exemptions, this is still a COVID-safe plan that protects the community. And if that agreement can't be reached, then it doesn't go ahead. But we're hopeful that that can. If that means they don't want to go to Sydney, and I don't know what's happening in Sydney. I don't know if they're going to have crowds at the test in Sydney.
Have you signalled any interest, though, with the Sydney people or Cricket Australia?
Look, I'm not liaising directly with Cricket Australia. That's being done by the Sports Minister. What Health are doing and what the Chief Health Officer's Public Health Unit is doing is negotiating what that would look like if they came here. If we can agree on how that would work to keep the community safe, that's great. If they want to play more games here, we've welcomed sport of all different kinds here in Queensland. We're happy to do that as long as we can reach an agreement on how we can make sure that's COVID safe.
Late yesterday you announced that you're lifting the reef tour boat restrictions. Mm-hmm. They've all been complaining up there because they haven't had full capacity. Are they at full capacity now?
Look, I'm not sure if overnight they've got full capacity, but I have no doubt that tourists and Queenslanders alike will be eager to get out onto the Great Barrier Reef. It is, it is a beautiful place to go. It is summer in Queensland. There is no better place to go than go visit the Great Barrier Reef and go out and see that beautiful World Heritage area. So we encourage Queenslanders to do that, and I'm hoping with the agreement that was reached with the boating industry around COVID-safe plans that they will see a rapid increase in their numbers.
Sorry, can we just clarify something with the show about
Sure.
the super yacht one? How many people total were on the boat, and where's the boat exactly now, roughly on the water?
It's in Cairns, and I don't know the full number. There are still 6 crew left on the boat.
Okay, but is it in the inlet? It's more.
I don't know where it is.
Okay.
No.
Can I clarify? This is the case in the southeast. Is that the second connected to
Yes.
all the beaches in Queensland?
Yes, so we had one case that came here on the 16th and the 17th and is now back in Sydney, and then we've got this case. They're the 2.
Is there any indication that the people who came off the super yacht had any contact with anyone else in the Cairns community?
No. They've gone straight from the super yacht into quarantine.
And when you say that super yacht's not cooperating with you, what information specifically do you want from them that they're not giving?
I want to know exactly where they've been and who's come onto that yacht while they've been overseas.
With the electronic records, this might be one for either of you. If there's things like charity lunches tomorrow happening for people who might be homeless, if someone doesn't have a fixed address or a phone number, how do they sign into a venue?
The venue needs to organise that so that they've got lists of who's been there, so that there is a way of contacting those people.
And what if they don't have a phone number or a fixed
Well,
address?
the venue needs to find a way that those people can be contacted.
One last question.
Just why the ADF won't be helping our borders this time around?
Look, the Commonwealth very quickly declared the cluster in the Northern Beaches as a recognised hotspot for the purpose of Commonwealth emergency relief, and I have no doubt New South Wales welcomed that decision quite early on. Look, as far as support, we would all like to see support and cooperation across the country. and we would all like to have that support on our borders. Our police have been doing an incredible job, but I know particularly Victoria and Queensland would welcome any support from the Australian Defence Force in helping us manage those borders. We have seen people trying to come over our borders. We're knowing that people are frustrated and wanting to get into the state, but that's all the more reason we need to make sure we know who's coming into the state and we know where they're coming from so we can protect everyone in Queensland. So we'd certainly welcome it, but that is a decision of the Commonwealth.
Just on borders there's anecdotal signs of people parking across on the New South Wales side, then walking across the border or catching Ubers across the border. Is the government aware of this and what measures are in place to stop
anyone catching an Uber, if they're in a vehicle, they're still required to have a border pass. It doesn't matter if you're an Uber, a bus, a truck, whatever you are, whatever vehicle you're in, you are required to have a border pass declaration to cross the border into Queensland. For those who want to flaunt the law, there are fines. There are fines for doing so. For those who want to give us false information, make false declarations, there are fines, and we will implement these fines. This is about keeping people safe. It's about making sure our economy can keep operating, that tourism can keep inviting people in and holidaying in Queensland. But most importantly, it's about keeping people safe and alive. We are still seeing record numbers of positive cases and deaths overseas. Record numbers of deaths. United States, 3,500 people a day are dying. This is real. We need to take it seriously. And for those who don't want to comply with the law, then they will be fined.
Minister, just quickly, when you've got the Chief Health Officer saying that she believes there could be cases in Queensland now that you don't know about, is it really appropriate to do things like relax restrictions on reef tour operators further?
Well, let's be clear again, when we use these terms, relaxations and exemptions, these changes can only occur in a COVID-safe way. So the changes to the charter boats and the boating industry in Queensland are because the Chief Health Officer and Queensland Health have been satisfied with the COVID-safe plans that have been developed. So there are still arrangements in place, and part of those arrangements that were announced yesterday include that everyone has to have an allocated seat on those boats. We know exactly who is on those boats, that when they're inside, which is far greater risk than outside, and we've talked about that, and the Chief Health Officer has talked about that numerous times, when you're inside, that you have a seat, you are allocated that seat, and you are staying in that seat, and you're not mingling. That is how we reduce the risk of transmitting COVID. So the Chief Health Officer has been satisfied that those COVID-safe plans can be put in place, and that is no different to what we have done with working with a whole lot of other industries and sectors right across Queensland to develop COVID-safe plans, including the sporting sector, to ensure that things can still happen, but done in a safe way and reducing our risk.
Thanks, fellas.
Thanks.
Thank you.